So for the heart assessment, we're going to start out with just doing a general appearance of looking at the hands and the nails. So I'd have my patient have their hands out and inspecting, looking at the skin, and then also at the nails, looking for any discoloration or clubbing of the fingers. And then we'd move on to looking at the jugular venous pressure. And after that, we would also observe looking at the chest, looking for any deformities or any asymmetry that would be happening with the chest wall that could later on affect the heart, whether it be a concave or convexity of the chest wall. Then we'll keep going through, and I would be looking at the epigastric and subxiphoid pulsations, just making sure that everything is within the normal limit and not seeing any pulsations that would be abnormal. And then I'll have my patient in the supine position and looking to identify any apical impulses. So I have you lay down on your back with your head up here. And I would be looking at about the apex of where the heart would be, just below the breast, looking for any pulsations that could be a sign of cardiomegaly. And then while my patient is still in this position, I can move towards palpation. So while my patient's laying down, I can palpate for the point of maximum intensity. So I'm going to instruct my patient that I'll be feeling around where the heart is near the breast tissue, so she's aware of where I'm going to be palpating at. And I'm just going to be palpating from lateral to medial and using a pen light to see any pulsations or anything abnormal that I could see in there. So and I'm just palpating to make sure I can feel the heart pumping and feeling for areas of higher or lower intensity. That looks good. And then also I'm going to be palpating for thrills, lifts, and heaves at the same time while I'm doing my palpations. And then can also do percussion. That'll be moving from lateral to medial, which this isn't always used, but another thing that we can do. So I'm just going to be resting my fingers above your breast tissue and be tapping on my fingers. Okay. And I would be doing this between the 3rd, 4th, and 5th intercostal spaces. And after that, we'll move towards auscultation. So I'll have my patient sit back up for me, please. And I'm just going to tell my patient that she can breathe normally during this. So just go ahead and relax and breathe as if you normally would. And I'm going to be using the diaphragm and listening to all the different valves of the heart. And everything seems to be sounding normal. And also while I'm doing that, I'll be trying to differentiate the S2 physiological splitting while I'm listening to the heart, and can also listen for S1 and S3 along with S4. And then during that, I can do some more special tests such as the aortic regurgitation evaluation. So for this, I'm going to be having my patient seated and leaning slightly forward. And I'm going to ask my patient to exhale fully, and then once you're fully exhaled, just to hold your breath for a little bit. And I'm going to just listen to your heart. Okay, go ahead and take a breath out. And hold. Good. Just making sure that I'm not hearing any regurgitation through the aortic valve. And then also going through and doing the mitral valve enhancement. So I'm going to have my patient lying in the left lateral decubitus position. So could I have you lay on your side facing me, please? And for this, I'll be using the bell of the stethoscope. And same thing as we did before, I'm going to have you fully exhale and then hold your breath at the end of that breath. Okay, can I have you move your arm to your side for me, please? Okay, take a deep breath in and out. And hold. Good. And then the last thing I would do is differentiate between a mitral valve prolapse. So I would have her in the same position, and I would have her do a Valsalva maneuver while auscultating the bell with listening to the mitral valve. So I'm going to have you, when I have my stethoscope on the area, I'm going to have you act like you're bearing down and putting pressure through your abdomen. Okay, go ahead. Good. And that would be it for the examination.